Picture this. You're in a hospital bed, kidney stone, an infection is spreading. A resident hands you a prescription for a standard antibiotic, but something feels off. You pull out your phone, upload your medical history to ChatGPT, and in seconds, a critical warning flashes on the screen. This drug could reactivate a life-threatening infection you had years ago. The resident's face goes pale. "Thank God you caught that," she says. "I only get 3 minutes per patient." That isn't a hypothetical story. It's what actually happened to OpenAI's head of applications, Fiji Simo. And it's the exact reason why 230 million people are now asking ChatGPT Health questions every single week. But here is where the story truly takes a turn. On January 7th, 2026, OpenAI didn't just notice this trend, they went all in. They launched ChatGPT Health, a dedicated AI assistant that can access your medical records, sync with your Apple Watch, read your blood work, and even tell you which insurance plan makes sense based on your health patterns. And people are absolutely freaking out. Now, before you dismiss this as just another tech company playing doctor, consider this number. Over 230 million people globally are already using ChatGPT for health advice every single week. That's more than the entire population of Brazil asking an AI about their symptoms. The demand was already there. OpenAI just built the infrastructure to make it safer, smarter, and frankly, terrifying in its implications. So, how does it work? Well, ChatGPT Health operates in its own isolated space, like a digital vault. Your health conversations don't leak into your regular chats. If you ask it to write a marketing email on Monday, it won't reference your cholesterol levels from Sunday. The data stays compartmentalized with what they call purpose-built encryption. They're trying really hard to avoid becoming the Cambridge Analytica of medical data. You can connect your medical records through a partnership with BeWell, the largest health data network in the US. You can sync Apple Health for sleep tracking, MyFitnessPal for nutrition. The AI isn't giving you generic advice anymore. It knows your body, your history. Let's say you upload your latest blood work. You ask, "How's my cholesterol trending?" ChatGPT Health pulls your lab results from the last 3 years, cross-references them with peer-reviewed medical studies, and gives you a personalized breakdown with citations, journal names, publication dates, everything. It's like having a research assistant who's read every medical paper ever published and remembers everything about you. But this is where we enter the ethical minefield. OpenAI partnered with over 260 physicians from 60 countries over 2 years to train this thing. They reviewed 600,000 model outputs to teach the AI how to respond safely. They even built a new benchmark called Health Bench, which evaluates the AI not just on medical accuracy, but on clinical reasoning, safety, and how well it handles uncertainty, the very things that separate a good doctor from a dangerous one. And the results? GPT 5.2, the model powering all this, outperforms human baselines across every healthcare role they measured. Let that sink in for a second. We're not talking about beating medical students on multiple choice exams. We're talking about real-world clinical workflows where the AI is making better judgment calls than trained professionals. Now, OpenAI is very careful to say this is not intended for diagnosis or treatment, and it's designed to support, not replace, medical care. That's the legal disclaimer, but let's be honest about what's really happening here. When an AI can flag a life-threatening drug interaction that a hospital resident missed, when it can synthesize your entire medical history faster than any human could possibly read it, and when 230 million people are already trusting it with their health, we have crossed a threshold. The question is no longer if AI will be part of our health, but what it means now that it's already here. Let's continue with other OpenAI launches. And it's not just consumers. OpenAI also launched OpenAI for healthcare for hospitals and medical institutions, places like Boston Children's Hospital, Cedars-Sinai, Memorial Sloan Kettering Cancer Center. These aren't small clinics. These are some of the most prestigious medical institutions in the world, and they're rolling out ChatGPT across their clinical, research, and administrative teams. Doctors are using it to draft discharge summaries, translate patient instructions, synthesize medical evidence, and align with institutional care pathways. One study with Penda Health found that an OpenAI-powered clinical copilot reduced both diagnostic and treatment errors in primary care. That's not theoretical, that's lives saved. But here's the uncomfortable truth nobody wants to say out loud. If AI can do this for health, what can't it do? We've already seen OpenAI announce they're building systems to automate real office work end to end. We've seen GPT 5.2 surpass human performance on reasoning benchmarks. We've seen them move into education with study mode, into shopping with agentic commerce features, and now into healthcare with ChatGPT Health. This isn't just about a chatbot anymore. This is about OpenAI positioning itself as the digital interface between you and every major sector of your life, your health, your work, your finances, your education. They're not building a product, they're building an operating system for human existence. And the privacy implications? OpenAI says your health data won't be used to train their models. They say it's encrypted, isolated, and you can delete it anytime. They offer multi-factor authentication and business associate agreements for HIPAA compliance. But let's not forget, this is the same industry that gave us the Equifax breach, the Facebook Cambridge Analytica scandal, and countless other "oops, we leaked your data" moments. The difference is this time it's not your credit card number or your political preferences. It's your medical history, your genetic predispositions, your mental health records, your fertility struggles, your addiction history. The kind of data that, in the wrong hands, could be used to deny you insurance, employment, or even custody of your children. OpenAI is making a bet that the benefits outweigh the risks, that the lives saved by catching drug interactions, the time saved by automating paperwork, the empowerment of patients who can finally understand their own health data, that all of this justifies the Faustian bargain of handing over our most intimate information to an AI company. And maybe they're right. Maybe this is the future of healthcare. Maybe in 10 years we'll look back and wonder how we ever managed without AI health assistants. Or maybe we'll look back and realize we sleepwalked into a surveillance state where every heartbeat, every calorie, every symptom is logged, analyzed, and monetized by algorithms we don't understand and can't control. So here's the question that should keep you up at night. What's more dangerous, ChatGPT knowing your entire medical history or ChatGPT knowing how to do your entire job? Because OpenAI isn't just coming for healthcare, they're coming for everything. And the scary part? We're inviting them in. We're uploading our data, connecting our apps, and asking for more. Because it's convenient, because it works, because the alternative, navigating a broken healthcare system alone, feels worse than the risk. ChatGPT Health is rolling out now to a small group of users, with wider availability coming in the next few weeks. You can join the waitlist on OpenAI's website. Whether you should is a question only you can answer. But one thing is for sure, the age of AI-mediated healthcare is here, and there's no going back. What do you think? Is this the medical revolution we've been waiting for, or are we handing over the keys to our biology to a company that's already outthought us?